Greetings, everyone. Welcome to our program for today, Diversity Dialogue with Dr. Tracy M. Downs. My name is Melody Pannell. I serve as Director of Diversity and Community Engagement here at UVA Health. Today we have, in celebration of our Hispanic Heritage Month, creating a visionary community for vibrant leaders here at UVA Health. I'm excited to welcome our special guest, Dr. Juliana Bueno. And I will do some introductions for us as well. Again, this is Diversity Dialogue with Dr. Tracy M. Downs, our Chief Diversity Officer and Senior Associate Dean for the School of Medicine as well. Dr. Juliana Bueno is originally from Colombia, South America. After completing her medical school and specialty training in radiology in her home country, she completed a clinical fellowship in cardiac imaging at Duke University Medical Center in Durham, North Carolina. Dr. Bueno has been part of UVA Health since 2012, when she joined the Body Imaging Division of the Radiology Department. Dr. Bueno is currently the Program Director of the Diagnostic Radiology Residency in our institution and the Vice Chair of Education in the Radiology Department, and also oversees activities in diversity and inclusion in her program. Through the years, she has dedicated her career to teaching, curriculum development, educational program optimization, and has participated in the creation of opportunities for international outreach in radiology and new education tracks for radiology residents at UVA. It is our esteemed pleasure and honor to welcome Dr. Bueno to our dialogue today, Diversity Dialogue with Dr. Downs. And so for some of you who may have joined us in our program earlier, Dr. Bueno was our special guest celebrating Hispanic Heritage Month for our UVA Health Storytellers and gave a wonderful presentation then as well. And so our dialogue today will be based upon our theme for our Hispanic Heritage Month, and also to expand upon our presentation that we had earlier, telling your story. Again, being part of this vibrant community of visionary leaders here in the Hispanic community at UVA Health. And then also we will welcome any questions that we have from our audience, and then also from online as well as we continue this dialogue. And so I want to give opportunity for Dr. Tracy Downs to again give any response, any feedback to the presentation that we were able to hear today from UVA Health Storytellers as well. And then Dr. Bueno will have opportunity to expand upon that, answer any questions, but expand upon that and share anything more in depth that she would like to as well. And then again, questions from the audience, and I have as facilitator a few questions of my own that I would love to hear from both of you. So thank you so much. We'll turn it over to Dr. Tracy M. Downs.
Thank you so much. And Dr. Bueno, thanks for being here with us. It's a pleasure, and really an iconic person here at UVA and someone who really leads by example. And before I dive into your talk, I just want to kind of just say a few things about Hispanic Heritage Month, and just an opportunity for us to kind of pause. And if there's one thing about any country, and I'll speak more about maybe this country of America, is there's a plethora of stories and accomplishments, and kind of the first and people who've been those great discoveries and supportive individuals. And as we know, not every story gets told. Sometimes stories are left out due to just general omission, and we just didn't have space or didn't know who to ask. And so, and then there's also the times where stories aren't included intentionally. And so Hispanic Heritage Month is an opportunity for us to make sure that we tell stories that maybe others aren't aware of, and to meet people who are leading by example and doing great things here at UVA and Charlottesville and beyond. And so we appreciate you sharing time with us and your journey. What really stuck out to me in your journey is a couple of things. Like, one is sometimes people, this will be the humor side of me, people will say, I came from X to here, and they'll say, I came from the jungle to here to to be at this great, academic. Now you can really say that, like you did come from the jungle, in the Amazon jungle. And so if we roll back the clock to maybe when you were this little, young person, maybe 2, 3, 4, 5 years old, did you always know you wanted to be a physician, or how did this all happen?
Right, I was climbing trees at that time. So no, I didn't know. I had, my mom was in healthcare. She was a nutritionist, and I think that was my first kind of like entrance to healthcare. I think I found that I wanted to take care of people. I'm the oldest of 4, and I always had that role in my family. So I think medicine became that combination of the sample that I had, of the skills that I had. When I was in Leticia, is the name of the city where I was born. I was born there, and I lived there until I was 6 years old. And then, I found that, but I think it's a combination of all these things that I found to be
That's great. And it just shows the power of a role model even more when it's your parents. And then it sounds, and as we're getting to know you more, it's almost this caring spirit. And I think the concept of, as I think about our kind of busy and crazy world, if we just kind of use serve and serve others, it's kind of fix a lot of our ills. It seems like you have been kind of born with that innate kind of caring nature, and you see outside of yourself, and then now you translate that to here at UVA. Can you talk a little bit about touch on education and how that is just almost like you have these inspired values, but your education is almost like a core belief in you and things from. Can you talk a little bit about that?
Yeah, I think, well, first I think that I go back to my Latin American parents who are huge big force in my youth. I've always seen it as to knowledge, to different life, and it's as simple as opening a door for someone. I also found that you can always enable that for others. So I think education has been the platform really that I use for develop my career to what I think is the service that I provide my trainings to my home. And the education platform the way things are, what we think that there. It's kind of like how that combination of the skills of how can they do and then open doors.
Children harder subspecialties in radiology. So, general, here, musculoskeletal, abdominal, and you are the facet radiology. How did this happen? Think a little bit about what's the
So I wrote part of the that the only I always thought fine, hard for us to do that way. I was interested in congenital heart disease. I was able to pursue subspecialty training where I did. And my days look like a basic clinical service. I think, these days, and especially during the last 4 years or 3 years with COVID, the thoracic imagers were the ones who were reading all the pneumonias and infectious diseases. It's interesting that in radiology, I also found a platform to educate. We are always trying to translate complex findings into more simple ways of understanding an entity, a pathology, a process. And that's why, they say radiologists are the doctor's doctor. And that way your role is always educating through a report, through the findings. You teach your students, you teach your colleagues, you have the opportunity to educate your patients. So it ends up being the field that kind of like, all those things where
That's really neat to hear, and a special thank you for COVID. And when I think about maybe the burden of care being unfairly distributed throughout the health system, I think oftentimes we think of the ER folks and we forget the radiologists who are reading those constant films and making critical calls on yes or no, if it is or isn't. So wow. So one thing that is it may or may not be common knowledge to our audience, but diversity in terms of gender and race or ethnicity is really been a hard kind of goal to achieve across all of academic medicine in this country. And in my field of urology, probably very similar. We have very few women who are urologists. It's getting better, but we're not there yet. And from what I can glean from radiology, I think it's also some challenges with women, and then the number of women, and also with the number of women from different diverse backgrounds. Can you speak a little bit of that? And what I kind of find really interesting is that you actually were encouraged to go into this field, and then you had a role model who was actually a male role model back in Colombia. So it's like you came into, when you made your transition into the US, kind of maybe with certain mindset that maybe others who look and say, I don't see, and maybe almost speaking to the concept of, I don't see anybody who looks like me in a lot of, so therefore I don't belong, or I can't strive to be that person. Yet you're in a field that doesn't often look like you, but you just like, boom, shot up through that area. So maybe you can share a little bit about.
As you say that, it's interesting because I think it's very personal. I've never seen myself as not able to do something because of my differences. I've been, again, blessed with an environment where those differences were valued. And of course, there are roadblocks and insecurities and things that are not, doesn't make it easy, but it never really crossed my mind the fact that women were less in that field. I was just so drawn to the content and the practice and the what it is to be a radiologist. I never thought of myself as maybe I shouldn't do that because I had met a woman there, which I acknowledge that is something that plays a role when you want to identify with someone who looks like you or speaks like you, or but it wasn't part of the factors that I was considering, and that may depend on my upbringing. I really never felt different. So I think, fortunately, I had kind of like the courage to just go for it without really thinking twice. And you start noticing these disparities or differences right in the practice, right? And I assumed the role where through education and through the role of program director, you realize the power that you have to really change the picture of radiology. So all the initiatives and support that we've gotten from the leadership in my department has been specifically to address that.
That's so neat. It's almost like, if I think I'm hearing you correctly, it's like there are these external kind of barriers or challenges that are always going to be out there. And then, we can construct these internal barriers and challenges that maybe are the actual stumbling block and never let us actually just plow through. And you just kind of like, I love radiology, I'm going to do this, and then just here I am.
And none of them are less important, right? Like I feel that we may be more aware of the external ones because they're more evident. But I do think that we need to question ourselves on what is it that I'm creating? Am I creating the limitations that I have? Or can I just do it despite the fact that nobody looks like me or nobody looks like me?
Well, we're grateful that you have.
Thanks.
Quite a bit,
I'm excited. I love what I do.
Well, I don't want to kind of take over all the questions, but
this is Diversity Dialogue with Dr. Downs. Absolutely. Again, I really appreciate, your agency, right? And it does take people with courage to move forward. And you have become absolutely a role model for so many. So I have one question to ask, and then I also want to make sure that we give the audience opportunity to make any comments or questions. But one thing too is you think about this as yourself and having that agency, maybe the way that you could raise, you talked earlier about faith and opportunity as well. And thinking about people who may not, as Dr. Downs alluded to as well, who may not have that agency or that background or that perspective, because it is, you have to see it. You have to, again, as a visionary leader, you have to see it first, sometimes to be able to do it. What kind of recommendation or advice may you give, if you will, to others who have similar backgrounds to you to think about, and especially as they're considering the field as well?
Yeah, I think that during my analysis, which really was my talk, the 4 or 5 factors that I identified, I think are common for all of us. We've all had opportunities, and those opportunities look different for all of us, but they are there. We've all had someone that we can look up to, whether it is a parent, a neighbor, a teacher. We've all had challenges that we have to overcome, and we have different tools to overcome them. And we all have this inner sense of purpose and calling to really identify what is it that is going to be meaningful. So I don't want to dismiss the fact that there are tangible limitations in many cases, but I also feel that inner power on those opportunities, the example that you have from others, can help you at least have the confidence to create a vision and a path for yourself. Now, it is our responsibility as leaders and part of a community to help enable that. So when we're having the conversation of what can we do as UVA health system, how can we help our communities, in this case, the Hispanic communities, is really opening those opportunities, creating and facilitating role models for them, providing opportunities for them to have access to the service and healthcare. And so it's a common effort. It doesn't, it starts with yourself, but I think you need to be in an environment where people can create that for you.
Absolutely. Yes, it is, in a sense, you're creating this. You're creating this vibrant community of visionary leaders. You're mentoring. I think what you shared just now, and even your presentation, it really is a roadmap. It's a roadmap to look for the role models, again, to look for the opportunities, to think about what your purpose is, and have that self-determination, which I greatly appreciate. It takes that so much. So absolutely, you are a visionary leader. You are, again, a role model for many here at UVA Health. I want to take a moment to see if there are any questions or comments from our audience online or here in person, and then we have a few other questions too that I will offer for Dr. Downs and Dr. Bueno as well. So any questions, any comments? Yes.
Hi, Dr. Bueno. My name is Ashley Wooder. I'm Director of Diversity Programs for School of Medicine and work with Dr. Downs and Melody. I think often about and work mostly with our students. So we have a summer medical leadership program. These are pre-med students from across the country. And we had 4 students from Puerto Rico this summer. And then I'm also working with our medical students, biomedical students here. in the school of medicine. So a lot of my thought and work goes into supporting students. If you could think back to, and I missed the first half of your talk, but if you could just think back to your time going through your educational journey, right, achieving what you've achieved thus far. Could you talk a little bit about maybe some of those challenging experiences, ones you're willing to share?
Yeah.
How you overcame those, and what keeps you going, right? It's a difficult field, right? It's not easy being a physician, regardless of specialty. Yeah, so a little bit about that.
So that's great. Thank you for the opportunity to do that analysis. And I always think that, it's a combination of factors. Again, some of them are depending on yourself, and some of them are external. The challenges, the biggest challenges, I think, that I've seen or experienced in more recent years have been changing countries. And I think that, we were discussing how you don't really need to be an immigrant or an expat, but you can apply the sense of lack of belonging when you're different, when you're new, when you have a disability, or whatever it is that you think that makes you different. For me, that was one of the things that I consciously had to, incorporate in my thought process to say, I speak with an accent. I have, a different background. I have this upbringing and cultural experience that is different from the place where I chose to live, and how am I gonna be part of that without leaving myself behind? So I think that that's the inner work in a way of how do you really fit in without changing yourself. And again, we can apply it to many situations and factors. And I feel that you go through the combination of experiences and challenges, and you end up growing, and you end up learning that it's okay to be different, that it's important to be different, that you can actually add to the experiences of others by and through those experiences that you've had. And it's like you're finding your role in a society. I always think of, and I think that that's why I included the sense of community in the Hispanic culture. It drives the decisions. You don't make decisions for yourself only. There's a deep sense of social responsibility. There's a deep sense of, I need to be useful. So the roles that I've taken, the paths that I've opened, are they useful? That's my question. Is this benefiting someone else? And in that way, you drive purpose from that, and that purpose keeps you going, right? And it really depends on each of us. What is it that you're looking for that is going to keep you going? It's different for all of us. In my case, is seeing the impact and having the capacity to make a decision that may benefit someone else. I think that's what I found so fascinating and engaging and powerful. And again, it's not my privilege; it's my responsibility to serve people. Because if you have the capacity to lead because of a title, because of whatever label you have, that comes with a huge responsibility. And I think that approaching that way kind of perpetuates the sense of meaning and purpose in what you do. And we all have the opportunity to do that, right? Students with many backgrounds, like I feel that part of their questions should be, what is it that I will be useful for, and how am I going to orient my career in a way that I can always have this well of purpose and sense of, right, that I can always tap on and continue, despite the fact that I will find challenges.
Thank you so much. Thank you. Other questions or comments that anyone may have as well from our audience?
Would you definitely address the issue of communication? You talked about how your role is often doctor to doctor, primarily, and then from there doctor to patient. What challenges or things do you see that could be better or working well in a useful or consistent flow of information, talking about the patients and with the kind of patient-based work with
Thank you.
You know, and it's an interesting question from the radiology perspective, because our role with patients is different, but you can also see how through radiology we touch every single part of the well-being of someone who goes through the healthcare system. So I think it's mostly looking at what's your opportunity through what you do to learn. I believe that we don't care for what we don't know. So the first thing that we need to know is get to know the community that we're serving, so we can care for them, so we can really connect with the things that are important for them, that are determining their health. And in the topic of social determinants of health, specifically in the Hispanic community, we need to get to know them. We need to know how they operate, what are their dynamics, what drives their decisions when it comes to taking care of themselves and others. You know, again, family and community are important. Those decisions are driven by almost a communal sense of health. It's probably more powerful to approach them in a community center than through Epic. And finding the differences is interesting and it's important, right? So again, it's getting to know who is it that we're serving, and in that way, finding the ways that are meaningful to connect and efficient ways to really impact their health. Limitations, which was part of your question, have you addressed those? I think we learn more about them as we start learning about the things that again drive their decisions, and what are the limitations that they have to access the care that they need, and that way we can address them. I'm not sure we can change everything, because when you think of social determinants of health, not all of them are in our capacity as a health system to change, but in many ways, the few ones that we can influence, we can definitely learn more and change them.
Thank you so much. Absolutely. So, other questions that you may have or comments? You kind of touched on a question that I was interested in as well, as far as the social determinants of health, and some of those questions that you answered. Absolutely. I think I will kind of just dig into a little bit more as far as social determinants of health as it relates to yourself as a health provider. What is something that you're maybe concerned about or most concerned about the Hispanic community, you know, as far as in the service of social determinants of health and healthcare, those things?
You know, when you think of the Hispanic community, I think it's too big of a group to define one limitation.
Absolutely.
You have a large part of the population, the Hispanic population, that is undocumented, unfortunately, and we have specific limitations that come with that. But I think the main ones are healthcare literacy, not being able to navigate a health system that is complex, that they're not used to, that they don't know, and they may not have anyone to show them the way. That's one of the opportunities that we as a health system have to really have connections for them to facilitate that access. The language, definitely, and you can argue that if you live in a different country, it is your responsibility to learn the language, but it doesn't always happen. So I think, you know, we have to be conscious of that and really create opportunities to have and offer resources that are easy for them to access. Again, understanding the community and the way they operate. I found that through small projects that I've done with students, the cultural background of each community determines how they behave around health. So if we create strategies to reach out to patients through, for example, the electronic medical record system, you find that people don't have access to internet, or that's not the way they communicate. They rather, you know, get the communication from the healthcare provider that goes to their church. And that just comes from the understanding of the culture of that group. So again, we can't care for what we don't know. So it is the effort that we need to put this into understanding what is it that determines their decisions and how can we influence those. And it will change according to the different groups, right? I think that, you know, if you think of racial groups and minorities and different heritages, all of them will have different factors.
So I don't know if Dr. Downs, you have any questions as well too. I'll turn it over to you. look at that. Just to think about, again, just your experience being here as well as one of our visionary leaders.
Yeah, well, I'm enjoying the conversation and just learning more about like your journey and then just how you kind of your perspective on life and a lot of things. It's really enriching for us here in the room and then hopefully for everyone out, kind of watching virtually and for our recorded crowd as well. I think I hear like Brian Stevenson, one of the famous lawyers in Alabama around social justice, talks about being proximal. And I think that's what you're saying when you talk about being close to our communities and I think you said you can't care for what you don't know. Yeah, which is really powerful statement. And then the access and the challenges that we face. And one of the messages we learned in COVID, I think in the community was exactly what you pointed out is it was reach out either through Facebook or we intentionally phone call people their results. We didn't email or anything like that because they were going to get lost in the shuffle. And then I'd be interested when you think about kind of maybe around language and like if there are things that we should do to better in terms of maybe it's how we read out the reports from radiology or how do we kind of tap into that sense of community. But like I always hear that we could do more on language in terms of our outreach.
Right, and it's a challenge. There's an example, if you've been part of interactions with patients who don't speak, let's say they're Spanish speakers and they don't understand English, and we have the resource of an interpreter. And it's a wonderful resource, but unfortunately is the intangible dynamics that you have with someone that you trust in, which is your physician. That's the biggest limitation for them to share, because despite the fact that it's their language, they don't have a sense of trust. So what they can share with someone who is their physician, who speaks their language, is absolutely different, from what they share with someone who's just translating. We had with a group of residents that, so we have a program that has in radiology that has diversity leaders, and each class has a representative, and they have this role of, participating in the initiatives that we have. And one of them realized this and created connections with the health system to have residents and radiologists who speak a second language fluently to get certified as translators to facilitate that communication. So I think that is understanding, despite the fact that you're providing someone or an iPad who translates, the connection between patient and doctor is not there, right? And that if you don't have that trust, the quality of the interaction, it's not going to be the same. So it's a challenge to figure out, how to really provide care when you're doing all you can by providing resources in your language, but really the element that's lacking is that sense of trust and connection.
Wow.
So it is, and it only comes from, again, understanding how is it that they operate, what is it that is important for them culturally.
That's so neat to hear because, we, in terms of offering our best care for our patients, right, our vision is, transforming health for all Virginians. And, I always like to say, is it all, or is it just some or a few? And so now it means the diversity of our workforce. So we don't have to have such a huge burden on our translators and our iPads and language services, but then also in terms of equipping all physicians to hopefully be, and nurses, et cetera, to be competent in different languages. But I love how you said that. And really, I don't know if it had registered at that level before. There's a study in my field of urology where I'd be interested to see how you would interpret it. A urologist out of New York actually looked at trust and giving information. And who they looked at kind of, in this case was white patient, black patient, and then the giver of the information was either a physician or a non-physician. And then it was either a similar black physician or a non-black physician or and what they found is that in this case, they trusted in terms of clinical trials or kind of adherence that the person who gave the information mattered. And then in this case, there was still that, maybe as we're progressing as a health system, there's still this old school mentality of, like, I want to hear it from the doctor. And we know our nurse practitioners, physician assistants are amazing, but that at times kind of who it comes from. So I'd be interested just your take on kind of hearing that about, like, race concordance mattered in that case. It was around prostate cancer information, and then it being from the physician. And I think you're saying that there's that, yeah. What do you,
Culturally, in the Hispanic community, there's definitely a cultural component that, funny enough, also goes with women. So when I was training, and I would go into the room with a male classmate, both of us wearing white coats, they would say the nurse to me and the physician to my colleague who were the same. So it's this perception of what is the idea that they have of trust and power in a healthcare provider, which is hard to change, right? And you're dealing with generational differences for, not only in physicians, but also in patients. I think it's hard to adapt to all the single situations that you may encounter. I try to find what are the common factors that we all as humans share so we can actually influence those, right? Because one size doesn't fit all, and it's not those cases.
I love, so you may or may not have had one of your residents or fellows, and I think as I get older, I see the world a little differently, and it goes back to maybe our off kind of camera talking about as our professional competence grows, then, someone confuses me, I'm okay with it at times, because I'm okay with it, and I also have other things I have to do, so I'm not as bugged by it, but, boy, when you're like that newly minute, like long white coat physician or newly coat nurse or something, when someone misidentifies you, it's almost like a stab in the back, and people, I'm interested in how you support your learners when maybe they are misidentified, and it is your resident who is the doctor, but they're maybe female or they have an accent and they're misidentified as not being that. How do you kind of help them navigate that, like, kind of assault on their identity and not lose focus for the long haul to be who you are now when they've got maybe 10 years, before they get there?
I think first is creating an environment where they can share those situations. I think you have those microaggressions and you suffer because you don't have a way to point them out and share them, right? They just add up to your own sense of inadequacy. I'm sorry. Because that's unfortunately what comes with being different in many ways, is you're always questioning, do I fit, right? And we were saying, do I fit the way I am, or should I modify my ways to fit in this? So I think the first thing that I would say is really creating a culture of open conversations around those situations where people have the opportunity to say, I didn't like that from this patient. The GME had great policies and a really good conversation. Susan Kirk brought it up at the time of COVID when we were having, patients deny the care or reject the care from either Black doctors or, whatever they thought it was different, and enabling people and giving them the tools on how to respond in a polite, responsible way, making the patient understand that it is our responsibility to care for them, but it's the responsibility to respect as well. So I think, taking into account all those things, I fortunately haven't had a specific situation that I can point out, but I do think that with good efforts on creating an environment that is nourishing for everyone, because and despite our differences.
I love how, and like, if I just thinking out loud, like if I went into your, chest radiology room and I didn't have a name for something, it'd probably be pretty hard to kind of dissect down to, like, well, what is this, and what are the characteristics, and how do you prevent it, or how do you treat it, or how do you not let it happen in the first place. And I think you putting a name on what happened in this example microaggression. This is what it looks like, and these are the characteristics. So it's almost like you're looking at the chest film, and you're saying, well, this is what an upper pole pneumonia looks like, and I'm probably out of my lane as a urologist, and then you're like, well, it could be this. And then nowadays, right, we're like, oh, let's not talk. Let's kind of de-emphasize dialogue. And you're saying, well, no, this is microaggression. It's what it feels like. These are the 5 bullet points that it fits in. And then rather than deny it or sweep it under the carpet and as though, it didn't happen, you're in some strange motion picture all by yourself, you're saying, no, it did happen. And it does demoralize. It does hurt your identity. It does make you feel like you don't fit. And then before you move on to that next step, I like that you didn't rush that step, but you said, and I can tell just talking with you that you create an environment that your residents and your fellows and probably your faculty are going to come and talk to you about things that they probably won't talk to most people. They'll just store it until they just set it like a volcano and like poof, and then they're,
I would hope so. I think that acknowledgement goes a long way, right? When you're acknowledging that it hurt or that it's not appropriate or that you don't have to tolerate it just because this person is in power or this is a patient or, right? And it only comes from really having those dialogues, as you're saying, learning what's right, what's not right, and giving people the tools that they may not have because they've been used to tolerating and just dealing with it, right? I think when you know what you faced, and it doesn't take that much to say, okay, yeah, that wasn't right.
I love the approach,
Absolutely, great approach. And like you said, acknowledgement is really the key. And so when I think about how we just create this vibrant community of visionary leaders, I think about again the mentorship we talked about as well. But to be vibrant, to be authentic, to be your full self, right? To walk in your difference. To me, that makes me think about vibrancy. So it is again to not be a community that's defeated or that is kept silent, right? That is not able to move forward. But you have this vitality, this aliveness to grow, to flourish, and to continue to develop other leaders is what I'm hearing from you and things that you're speaking about, which really makes me feel excited. It also looks, again, we recognize limitations, but we don't let them defeat us, right? We acknowledge them. We also hear from the community, what is it that the community needs? As you said, get to know the community and what are their needs. What are the ways that is helpful for them? How do they communicate? How do they receive information? How can we build trust? And how do you build trust? And relationship is so important. And many times, of course, things sometimes can be very cut and dry, black and white, factual. But it is, the information has to come, not just for the information's sake and the knowledge, but also the relationship and the rapport and how that's so important for that. I think it's wonderful information for us to know. We really appreciate getting to know you.
Thank you.
Greatly as well. And so as we prepare to close our time, and then we'll continue our dialogue outside of this program, but just open up for any other questions or comments from the audience. And then we will turn it over to closing remarks from yourself, Dr. Downs, and then I will close it up as well for our time together.
Thank you.
Anything else you want to share with us or share with the audience?
No, I think first, thank you for this opportunity. I think, we never think of ourselves as, or very few times we get to a point where we can think of ourselves as someone who can contribute to the conversation or an example or so I appreciate that you're opening this opportunity for people to tell their story and really just share, how we have gone through life and made a difference in many ways. The acknowledgement of our differences and the acknowledgement that, the heritage matters. The cultural components of, our society matters. And the more we understand it, the more we tolerate it in many ways. Because if you think of the conflict that we have, especially in this political environment, comes from lack of tolerance. Lack of tolerance for someone who's different, lack of tolerance for someone who we think that doesn't belong and doesn't fit. So I do think that we're putting a little, grain of sand, trying to make a difference by just opening that opportunity to open, to talk about it. So thank you.
Yeah.
Appreciate it.
Thank you so much, Dr. Bueno. What a rich time that we've had with you, and to learn from you and learn with you, and just the example you show on a daily basis is amazing. And I hope the listeners and viewers of this get a better sense of you as a person. And boy, are we lucky to have you here at UVA.
Thank you. I'm grateful to be here. Thank you.
So
we, yes, thank you so much as well, of course, for being our special guest. And also, again, to the audience, to those who will watch this recording, for those who are online and those who are present, to our colleagues as well, and everyone on the team for the Office of Diversity and Community Engagement as well. And I want to say, too, that this idea of storytelling, it really is something that I feel very, very passionate about, especially in the realm of diversity, equity, and inclusion, because it is, again, getting to know someone's story and to, like you said before, when we get to know people, we can then understand, we can learn to, again, celebrate people and hear their stories and lift up stories that are sometimes not always heard, right? Or maybe assumptions are made about different heritage or different people from different backgrounds that are different than us. And so I've learned so much from you and from this time together, and it's always good to have dialogue. So we appreciate Dr. Tracy Downs as well for the dialogue with Dr. Downs, and also everyone for participating. Please stay tuned for more programming for Hispanic Heritage Month, as well as we look at, again, just cultivating a vibrant community, create a vibrant community of visionary leaders as we go forth and celebrate our differences and also live into our Aspire values here at UVA Health. So thank you very much. On behalf of the Office of Diversity and Community Engagement, my name is Melody Pannell, Director of Diversity and Community Engagement, and this has been Diversity Dialogue with Dr. Downs. Thank you.
Thank you.